Now we are going to describe the mandible. The mandible consists of a body and two rami. The two halves of the body of the mandible meet each other in the median plane at the symphysis menti, which ossifies by the end of the first year of life. The lower border of the body of the mandible meets the posterior border of the ramus at the angle of the mandible, which changes by age. It is obtuse in young age, perpendicular in the adult, and becomes obtuse again in old age. This is the external surface of the body of the mandible. This is the symphysis menti, showing the mental protuberance as a triangular elevation having a mental tubercle on each side. Lateral to the symphysis menti, there is the mental foramen, which transmits the mental nerve and vessels. Inside the body of the mandible, there is the mandibular canal. The entrance of this canal lies on the inner surface of the ramus and is called the mandibular foramen. The anterior border of the ramus is continued on the external surface of the body of the mandible in the form of a faint ridge called the oblique line. The buccinator muscle arises from the external surface of the body of the mandible opposite the three molars. The upper border of the body of the mandible is termed the alveolar process, which carries the sockets or alveoli of the teeth. It should be noted that a gap exists behind the last molar tooth between it and the anterior border of the ramus. The lower border of the mandible is termed the base of the mandible, that gives attachment to the platysma. The digastric fossa is a depression on the lower border of the mandible near the symphysis menti and gives origin to the anterior belly of the digastric muscle. The ramus of the mandible has two processes projecting from its upper border. The condylar process posteriorly and the coronoid process anteriorly. The condylar process comprises the head and the neck of the mandible. The mandibular notch lies between the two processes. The head of the mandible articulates with the mandibular fossa to form the temporomandibular joint, which is a synovial joint divided by a disc into two compartments. The front of the neck of the mandible gives insertion to the lateral pterygoid muscle. The coronoid process gives insertion to the temporalis muscle. The lateral end of the head is projecting and can be felt below the posterior end of the zygomatic arch. It can be felt moving when the mouth opens. The lateral surface of the ramus of the mandible gives the insertion to the masseter muscle and is covered by the parotid gland. The medial surface of the ramus presents the mandibular foramen, which leads to the mandibular canal that transmits the inferior alveolar nerve and vessels. The medial border of the foramen is projecting to form the lingula, to which the sphenomandibular ligament is attached. Just behind the lingula, there is the mylohyoid groove that lodges the mylohyoid nerve and vessels. Below the mylohyoid groove, the medial surface of the ramus is roughened for the insertion of the medial pterygoid muscle. The internal surface of the body of the mandible presents the mylohyoid line as an oblique ridge that runs downwards and forwards from just behind the third molar tooth to the digastric fossa. The submandibular fossa lies just below the posterior part of the mylohyoid line and lodges the submandibular salivary gland, while the sublingual fossa lies above the anterior part of the line and lodges the sublingual salivary gland. The mylohyoid groove extends below the posterior end of the mylohyoid line. The elevation on the internal surface of the symphysis mentae is called the mental spine and is composed of two genial tubercles. The superior one for the origin of the genioglossus muscle, while the inferior is for the origin of the geniohyoid muscle. It is to be noted that the body of the mandible increases in length by bone deposition on the posterior border of the ramus, accompanied by bone resorption from its anterior border. This gives more space for eruption of the molar teeth. This process also affects the shape of the angle of the mandible, which changes from being obtuse in the young to be more perpendicular in the adult. This was the end of the description of the skull and mandible.